For more stories like these, go to www.social-tv.co.za, subscribe to us on YouTube and follow us on our social mediums.
You're listening to our social newscast with me, Sam Marshall, brought to you by www.social-tv.co.za. And today we speak to Bernard Katz, who's the Senior Manager of Product Management at Broadreach. These guys have developed a tech app that has done over 2 million COVID screenings in South Africa. Today we talk to Bernard about the role of tech in fighting the COVID-19 pandemic. First of all, congratulations on your 1.7 million screenings. How did that come about?
Right. Thanks, Sam. Thanks for hosting me on social TV. It's been an interesting journey with the Department of Health in Mpumalanga and KZN. We've actually been working with them for a number of years now on a variety of different health issues, including HIV and TB. And so when the COVID pandemic struck, we sat down with them and we said, based on the technology we have, which is Advantage technology, and the work that we've done already, how can we assist them? And at the time, it was really South Africa was launching this mass screening program. So we got involved in that with a screening app that then allowed a healthcare worker to go out into the field with a mobile device and undertake these various screenings. And it was really, I suppose, our ability to configure the technology quickly and then to scale that allowed us to get to 1 million screenings, I think it was after just a month. And then, as you said, 1.7 shortly thereafter.
One thing is evident, Bernard, that technology has a massive role to play. And if at any point somebody doubted the role of technology, that COVID was the perfect platform for the use of technology and also implementing technology quicker into environments. What are some of the lessons that you've learned as a company in terms of how tech can really change the game in terms of dealing with COVID-19?
Well, first of all, you're 100% right. I think that the pandemic has created a fairly kind of unique situation and created some serious challenges in that, I suppose, the speed at which it struck and the impact that it had. I think the first thing to realize is that technology can support that and helps with speed and helps with providing a unique view of what's happening. But it is also really about a partnership between technology and people. And so it's about having an understanding about how the health system works and what are some of the key answers, I suppose, that leaders within the health system require in order to make better decisions, to make timely decisions. So what technology allows you to do is to be able to quickly bring together many different sources of data into one place. It allows you to analyze that data and to use various sophisticated analytics models. And then, importantly, it allows you to present those insights, but also not just the insights, what actions are actually required. So what I mean by insights is an understanding of the situation, understanding of the problem. And what I mean by action is, what should you do about it? And so it's not just about understanding, for example, how many COVID cases there are out there. It's also about understanding the ability of the health system to service or to address those cases. And then on top of that, it's about how to actually distribute resources in the right way. So what action should I take in order to most effectively handle the pandemic? And so technology gives you the ability to speed up that response and to make those decisions in a timely way.
You're really then talking about, which is one of your first insights in your presser that was sent to me, about a hybrid approach between man and machine. But then there's something else that comes to mind almost immediately when you talk about this hybrid approach, this ability to understand the data and then leverage it into action. How do you then develop the skill very quickly? Because COVID didn't really allow a lot of people the opportunity to do proper skills transfer and train. How were you able to then bridge that gap to say, here's the tech, this is what it can do, but if we're looking at the hybrid model, there's a man and machine relationship here. How did we get man up to scale quickly?
Yeah, well, even though COVID is a unique situation, there are parts of it that are fairly common. It is a disease, and in South Africa, we've been, for example, tackling HIV for many years. And I think in the work that we've done with the Department of Health, taking this demand and supply approach is just as relevant for HIV as it is for COVID. And what I mean by that is, how does a manager within a health system manage a disease and understand what the demand the disease is placing on the health system, and understand the supply of healthcare services necessary to meet that demand? And so those kind of lessons are that the Department of Health and that's the work that we've been doing over the years has actually been very relevant and applicable within the COVID situation. The interesting thing about COVID is that it has really, I suppose, focused the mind, let's put it that way, on this has to be done now. It wasn't a matter of months or quarters or years. It was a matter of days and weeks that we really needed to understand what's going on. And I think vice versa. I think we're going to come out of the COVID situation and have some very interesting lessons for dealing with certain chronic diseases, for example, like HIV. And that how do we kind of speed up the response? How do we understand the demand and the supply side of the health system and use technology to speed up our ability to make decisions?
I can only imagine then that you're talking about a ton of data in real time as the information comes in. How do we then classify the data in terms of that relevance, in terms of allocation of resources? Also in your statement, you talk about this is not about geeks and individuals sitting behind computers dealing with a ton of data. This is about real people.
Yeah, so I think we don't come at this challenge from a technology perspective. So it's not technology for the sake of technology, right? We come at this challenge with 2 decades of population health management experience. And through that, we're able to understand what is it that a manager, whether it be in a rural clinic in KZN, whether it be at a regional hospital or a provincial executive, what are the questions that they're trying to answer? Once you understand those questions, then you really have to then work out, well, what models exist or what models do I need to develop in order to answer the question? And then finally, what data is required as inputs to those models. So then you're not going and mining the whole world for every piece of data. You're going and you're finding specific pieces of data that will allow you to answer these key questions that then help managers gain insights, take action. The other side of it is that the technology you use needs to be flexible enough to handle many different data and different states of completeness and different formats. And now you need to be able to take that pack of data and bring it into the environment, the technology environment, and then be able to use it in the models to be able to answer the questions that managers are asking. And I think the ability to be able to do that, one of the key, I suppose, areas which has been of benefit to us is that the Vantage technology is built on the Microsoft Azure cloud, and that allows us to be able to configure it as well as scale it very quickly. So we've been able to, when I talk about configuring, I mean bringing in different data sources and then scaling, kind of growing it so that you can reach 1.7 million, we're almost at 2 million now, screenings within a very short space of time.
Bernard, how does this kind of technology help you with potentially those that have in the first screening, they were clear of COVID, and then potentially there's a reinfection rate?
Right.
Does the data speak to that kind of stuff? Does the tech talk to potentially somebody who was screened a month ago and then there's some kind of measurement tracking system built in?
So at an individual level, it's mainly focused on the people who test positive and monitoring that progression. But I think what has been interesting in the South African context is that we started out with a mass screening strategy where it was literally door to door. We trained something like 10,000 community health workers in 2 days to then get onto the mobile app and start this kind of mass screening door to door. And that's a very good strategy at the start of the pandemic, where you don't have a lot of suspects or a lot of positive people. As now, literally over the last 2 or 3 weeks, from the early June, the strategy then shifted to say, well, now let's focus actually because there are more and more people who are showing signs of symptoms or are actually testing positive, let's focus more on those and the need to start identifying hotspots or clusters. And so the technology then supports that change in strategy from this kind of mass screening to a more focused approach where we're focusing on clusters and hotspots, and then going and screening more in those clusters and hotspots as opposed to just broadly door to door.
Maybe this is an unfair question. I wanted to get your sense in terms of how government has been dealing with the COVID-19 pandemic from a technology perspective. Are you happy that tech is being used to the best of its ability in every province the way it should be used?
Right, so I won't be able to talk to every province, but I can give you my experience with working with the departments of health in Mpumalanga and KZN. I think what I have been impressed about is that the Department of Health has taken a data-driven approach, let's call it that, to managing the pandemic. So there are regular sessions to analyze the data and then to make decisions based on that data. And I think that's where, again, the technology can support that, because you're getting in data from the previous day, and the next morning, 9 o'clock, you're able to sit down, analyze that, and then make decisions as to where to send teams for screening, or where certain areas of the health system are not as prepared as they should be. There are obviously challenges when it comes to tackling a pandemic like this that hits kind of so fast and so hard with such an impact. But from a technology, or from, let's say, a data technology perspective, I think there's been a good application of that technology in this case. And the thing is also, we're learning. I mean, initially we started out with a set of indicators that came from the screening survey, and those have evolved over time, as they should. As the pandemic evolves and as we kind of focus on specific aspects of the pandemic, those indicators should evolve. So I think from a data technology perspective, I think the response in Mpumalanga and KZN has been good.
Tech allows you to scale up, but in order for you to scale up, you need strategic partners. You've talked about Mpumalanga and KZN. Where else is your technology being used, or which partnerships have you formed in the other provinces to be able to use the same kind of data sets and technology?
Right now, we are in discussions with several of the other provinces to look at different aspects of their response to the pandemic. Broader speaking, though, we have worked across a number of different disease areas in a number of different countries. So, and when it comes to COVID specifically, those discussions with both in other countries and with other provinces are continuing.
This tech really does allow you to speak to other data sets from around the world, allows you to plug into other partnerships globally. Am I right when I kind of pointed in that direction, that with this kind of technology and the work that you guys are doing, it's easy to plug into WHO and kind of share information and best practices and that kind of stuff?
Yeah, that's 100% correct. So I think there are different levels there. So for example, a particular methodology or algorithm that is used to forecast the growth in the disease could be used as an underlying methodology within Vantage to then generate insights which get presented in various ways to healthcare leaders. That's just one aspect. Obviously, the data itself could become a valuable resource to understand the pandemic in more detail. We are currently feeding data directly in an automated way to the National Command Center within the South African environment. But I think going forward, that data in itself will become valuable. The other interesting, I suppose, byproduct, let's call it, of the mass screening campaign is that we, as part of the screening, we were also asking questions around comorbidities. And that has created a very, very interesting data source of other diseases that exist within these communities in South Africa, which I think has real potential to add value in resource distribution and planning the health system in the future.
What is your projection? You just under 2 million or just over 2 million? You would project it to screen test how many individuals?
Well, I mean, at the moment we're increasing or the increase in screening, let's put it that way, has slowed down slightly because of the change in strategy. So I think our real focus now is more actually on the number of suspects we're identifying and the number of positives that are being identified. So I think the days of the kind of mass screening where we were doing 60,000 a day, at some point we're doing 350 a minute, rightly so, is no longer appropriate. So it's really about identifying as many suspects as possible with as little screening as possible, and then obviously testing those and isolating the ones that test positive.
Bernard, thank you very much for your time.
All right, thanks, Sam.
That was Bernard Katz, Senior Manager of Product Management at Broadreach, talking to us about their tech app that has reached over 2 million COVID screenings in South Africa.